Relief is coming for those in the child care industry. Over the next 2 months, North Carolina state officials say they'll be sending money to workers and some families who need child care right now. It's an effort to lessen the impact on what officials deem as essential service. News 13's Caitlin Pinter spoke with one Swannanoa daycare about what this money means.
So as we face this pandemic, we know our early childhood workforce is a support system that allows our essential services to be there for all of us.
North Carolina health officials say bonuses will be going out in April and May to child care teachers and staff that work in programs serving essential workers.
Child care programs that stay open to serve those essential workers will receive $300 per month for each full-time teacher and $200 for full-time non-teaching staff members.
The owner of Creative Village Childcare in Swannanoa says her workers deserve this money.
It's something I'm glad they're doing. It's something I'm very anxious to get to my workers.
She says the way they operate has become much tougher.
It's one of those, it's there, we follow the guidelines that are set by the state because they're a lot stricter than normal.
Guidelines include daily health checks of the 20 to 25 kids they care for every day.
You have to ask questions. You have to pay attention to symptoms such as like the runny nose, the coughing. A child has to be symptom free for, the state says, 3 days without the help of medication.
The state is also helping some families pay for child care. Here's who qualifies for this help. Those who are essential workers fighting COVID-19 or protecting the health and safety of communities, people with income below 300% of the poverty line, and those who feel they have no other viable child care options. All three criteria must be met.
With coronavirus putting restrictions on face-to-face contact, Western Carolina nurses in a primary care residency and fellows program are helping, especially low-income seniors, by phone.
The building housing Western's nursing program may be empty, but the people who make up the school are full of ideas to continue their care.
We haven't slowed down a bit. We just pivoted and went virtual.
Kay Livesey heads up the RNs in primary care program. She says the school partners with area low-income senior housing facilities, the nursing students providing prevention and outreach, normally with in-person checks, but now over the phone, checking their general health symptoms they may have, concerns about food or supplies.
The need to have a registered nurse and the skill set that a registered nurse brings on the phone is critical now more than ever.
Livesey says the virtual team started with a half a dozen a couple weeks ago, now over 30, calling and listening. She relays one recent call.
She said, I audibly heard them wheezing over the phone. And so, her guidance was, you really need to call your provider's office.
They have been very appreciative of us checking in on them.
Tina Cook is in the program. She says trust is now established with the folks they're checking on, and she says they have pulled together.
And to help one another and keep social distancing at the forefront for sure, one at a time in an elevator.
Cook says even through the phone, there's a connection to the residents.
He says, when I talk to you, I feel like I'm talking to family.
She sees a telehealth possibility even after this crisis.
If that could ever be coordinated with primary care providers, I think it would be a great service.
Asheville's free fare program to reduce the risk of spreading COVID-19 raises concerns for transit drivers. The president of their union said it's led to an increase in drug deals in the back of city buses. News 13's Kimberly King joins us now live from downtown. And Kim, drivers have received protections.
Tammy, they have. They do have masks, and also there is social distancing taking place with regard to passengers who now have to load in the back of the bus to stay away from the drivers. Still, drivers are very worried about potential COVID-19 exposure, and also, as you mentioned, drug deals they say are going on the bus.
The bus drivers are tired of reporting.
Diane Allen, president of Union 128, says Asheville bus drivers are seeing problems since fare waiving began March 20th.
Are your bus drivers seeing an increase of drug deals going on the city buses?
Yes, that's what has been reported to me numerous of times.
One driver texting Diane, "I'm about to snap. We need police," over rider concerns.
Criminal activity has increased.
Another concern is close contact with disabled riders who need to be harnessed in, and the city's order.
The last report from the city was essential rides only. You know, if that's going to be essential rides only, then we need to police that some shape, form, or fashion.
In an email response to the union obtained by News 13, a city transportation staffer says, "My suggestion regarding people riding for no reason is that security or APD remove them. Overall, she feels the city must give drivers more protections during the crisis," citing the Detroit driver who vented on Facebook and tragically died from COVID-19.
And cough several times without covering up your mouth, and you know that we in the middle of a pandemic, that lets me know that some folks don't care.
The city has told us drivers have been instructed that any reports of passengers breaking the law or not following social distancing requirements are told to call Asheville Police.